Welcome to Breathe California TV. Each week we present a show designed to help you understand lung diseases, particularly to prevent them. Today we're going to be talking with a woman I've been proud to know for 30, 40 years, Dr. Lulla, who recently retired as a doctor who's an expert in respiratory diseases. We're going to be talking today about COVID. And just hang on, in 30 seconds, we'll get started. See you then.
It's given me a chance to get out and be with people who has the same problem. And it helps you to manage your life better too, because you hear different things from each person, and it's just been really helpful in many ways.
Welcome back. I'm Terry Trumbull, a volunteer for Breathe California. We've been doing our TV show called Environmental Concerns for 33 years now. It's been our honor to be on once a week in San Jose and Campbell. About a year ago, we started in Santa Cruz County. So about 1.3 million of you have a chance to see us. Dr. Lulla, welcome back. I think you're the most frequent guest we've had on the show.
So should I assume that I'm more popular?
That's it. We have thousands of requests that said, bring us more Dr. Lulla. So we're talking on this show about COVID, and would you say it's still around these days?
Well, I think the new cases are definitely lower, and because partly the people have become, just what's known as immunity, herd immunity. I think people have been vaccinated, and those who are not vaccinated, the spread is not as it was a year ago. In 2022, I used to volunteer at these COVID stations, and we had patients come in for their immunity for the booster shots. So I think most of the population has been boosted. So we are not seeing that many new patients. And should I say, there's been an acceptance of this epidemic now. So the population is not that angry when it first started. And, we were all upset with China. And I think that has come a long way. Yeah.
So the president in a State of the Union speech said that we've got COVID under significant control with great reductions. Would you agree with that?
Yes, I would agree with that, because we stopped all those booster shots. We used to have these stations. I mean, people can still go in, but we're not having extra effort in the community. So you can still go to your doctor, or you go to the health, you can go to the pharmacy. So all this has been passed on to the pharmacies. You can go to Long's or any drug company and get your vaccinations. So you don't necessarily have to go to your doctor or to the hospital. Yeah.
So I don't have any worries about the vaccines. I've had what might be called normal vaccines. I don't know what you would call. And then I've had additional
boosters.
Shots. Yeah, boosters. What's your view about what would be a good sequence to have had now? I have heard that the Center for Disease Control is recommending that you get one booster a year. Is that make any sense to you?
I have not heard that. So, and I have received no notice from the hospital. I volunteer at a medical center. I haven't heard about the third booster yet. So 2 boosters is what up to now. is what and I think since the epidemic is now quietening down, they're not pushing it as much as they did initially.
So let's do a little bit of background. Why does Breathe California worry about COVID? We obviously need to worry about people's health in general, but COVID is a lung disease.
Well, that seems to be the primary focus. Some people have had other symptoms like, um, headaches or like influenza, like a flu type of symptoms. But it can, of course, in the elderly and people who are already immunocompromised, if you are dealing with, say, uncontrolled diabetes or any other underlying condition, then COVID can take a toll on your body. Okay, so the symptoms may not be something that your immune system can handle. And then you get, those are the people who get hospitalized because they have pneumonias, they have headaches, they have symptoms of like a severe influenza type of illness. So the elderly or people who have some other underlying conditions like uncontrolled diabetes or other health issues, then 2 and 2 becomes, not 4, it may become 8. So you have to be careful if you have some other health issues, then COVID doesn't spare you. Yeah.
So I remember an article about a month ago that said that something like 84% of Californians that had COVID. Does that sound like a good number?
I think that's not correct. 84% have had COVID or they were test positive.
So I'm asking you, that number seems high to you?
Yes, yes, very high. Very high.
So I had COVID in May of last year, and it was extremely easy. I just slept for 12 hours for 2 days and tested negative. I was given some sort of flu medicine that was supposed to help my resistance. Should I be out there getting another booster, or is having had the disease a significant protection?
I think if you had your 2 boosters, that's not gone for third booster. So given that you had your boosters and you also had a visit by the virus in your body, I think you're fit. Now, what can happen, and this can happen in the scientific background, because the influenza, the flu vaccine, every year it's a new vaccine, because the virus changes its nature, so we change it.
Well, talk a little bit about the evolution of the COVID virus. I don't think we're very used to the fact that the virus changes so quick that we have to keep making changes. It's only been with COVID that I have any recollection of that type of behavior. So explain what's happening, if you don't mind.
As I mentioned, the influenza virus, when you get the flu vaccine, if you get the flu vaccine this year, the virus that has been put in this vaccine is last year's virus, because we don't know what the virus is going to be like in the current year, in 2023. So in 2023, when you get a flu vaccine, you are getting the virus which is contributed from 2022. So it's a year behind. So coming to the Omicron here, we think what we've had up to now, if you had both your boosters, you are fairly well covered, is what is the current consensus. So nobody has recommended a third booster. So 2 boosters seem to be fairly control the problem of the latest virus with the Omicron. Now, if there is a mutation again, say from China, and that virus comes into this thing, then we may have to modify our vaccines. But up to now, they think what we have is fairly effective.
So, could you explain what a mutation is and tie that to COVID?
Well, mutation would be defined as a slight change in the virus which attacks your body. Okay, so whatever strain there was, I guess the children and the the virus replicates very fast, maybe in 6 to 8 hours. So the progeny of the past, I mean the grandparents, whatever gene they had, the virus changes depending on the environment. So that's now, if the new strain happens by this generation change, then our system may not be able to handle it. But up to now, the vaccines that have been given for the past strain are protecting. They have not found that. So if the virus again continues replicating and comes up with a newer model, then we may have to change our vaccines. But
It seems like the COVID virus has mutated more quickly than with other viruses, or is that true? Is this just kind of normal?
I think no, it's not normal for the virus to replicate because virus wants survival. It's a question of who's going to survive more, the virus or the human beings. Okay, everybody, every living organism wants to survive depending on the environment. So they mutate. I think human beings also, our immune system gets ahead depending on what's rampant in the environment. So like in the old days, we had tuberculosis, and tuberculosis is not a virus, it's a bacteria. But the most important thing is the influenza virus. It mutates every year, so we have to get a new influenza vaccine. Of course, this year's vaccine is dependent on the virus of 2022. So the vaccines that are evolved are usually based on the past strains. So things are on hold right now. We're just observing the current status. And as the incidence seems to be slowing down, there has been a hold on recommendation of further boosters. Does that make sense?
It does. So we've been talking with respiratory disease expert Dr. Sullochina Lulla. We will be back in about 30 seconds for more on coronavirus and how it affects you. Stay tuned.
What it feels like to have an asthma attack is, well, you can't breathe and you can't tell anybody that you're having an asthma attack because you can hardly talk. You can maybe say 1 or 2 words, but you can't say much else. Breathe California has helped me come in contact with more asthmatics and more people who have the same case as I do. It's important to me because I don't feel like I'm alone in the fight against asthma.
Welcome back. This is Breathe California TV. I'm Terry Trumbull. We always can use volunteers at Breathe California. Give us a call at 408-998-5865, or just to learn more about Breathe California. Both Dr. Lulla and I have the website underneath our names on the screen, lungsrs.org, but volunteers are greatly appreciated. So, Dr. Lulla, let's go back to the start here. Do you feel like the Chinese government should have done something differently at the start of this virus?
Well, I'm not much of a politician and don't keep politics, but at the impact that this virus has caused the whole world, yes, the Chinese government should have been more careful. If they knew how dangerous this virus was and how fast it was going to spread, I think they should have controlled the spread of that epidemic at the start in China and not let people travel and then spread the word. I think in history, there have not been that many infections, which have been pandemics all over the world. So this is a learning lesson for us that if in future there is an organism detected in any country and it's known that it spreads very fast, the government should be responsible in having some measures in place to control these epidemics.
So I think clearly the Chinese could have done a better job. They're now trying to do that, but the problem got a lot bigger before they took it on.
Well, let's not enter into politics, the science, and how we're going to deal with our neighbors and our relatives and our community and our country, and of course the world. We should all have an armamentarium to deal with it.
So you mentioned past epidemics. Neither you or alive in what I think of as the last big one, but I remember reading that the Spanish flu, as we called it, killed something like 30 million people in the earth, which was 1918, and it was more than World War I killed. So we do get some epidemics, but 100 years between would be nice.
I think things like vaccines were probably not evolved 100 years ago. Okay, so now we have the science. So in fact, what they're looking at science is now they're ready. If this Omicron, again, changes its strain, changes its attack system, I think we are fairly well prepared for the mutations. If the new mutations happen, then we will develop the vaccine very fast.
Yeah, it seemed to me like the vaccine got developed pretty doggone quickly. My mom got polio in around 1948, and I didn't get vaccinated for it until 1955. So we didn't take 10, 20 years because polio had been a problem for a long time before then.
Well, it's gotten faster now, isn't it? I mean, did we know that you'd be able to go to the moon? When you were growing up? We didn't know that, did we? Yeah.
No, it would have been a laugh.
Yeah. And now people want to live in the space. I think they're going to be selling houses in space. You may have to bid for the market. Okay.
Yeah, well, I think our exploration and settlement of space is inevitable, just like it was in Columbus's time, which was 600 years ago. Everybody would have laughed if you thought that there were 1 billion people in the Americas when Columbus first got here. So we've got about 5 or 6 minutes left. What have I forgotten to ask you? What do we need to know about COVID?
Well, I think if you're having symptoms, if you've had COVID and you're having what I thought that's what we were going to discuss, is these long haulers. Some of them are not able to shake off this effect, and they have various different lingering head problems. Some of them have headaches, and they have a general weakness, and the ones who are very sick, they may have symptoms of like influenza, pneumonias, etc. It all depends on your immune system. And of course, at the ends of the curve, the elderly and people who have some underlying health issues, 2 and 2 becomes 8, doesn't become 4. So I think we have to be aware in the community of people who are immunocompromised, and they should hopefully have been vaccinated and have taken their boosters so that they're protected to some extent.
So can I phrase that this way? Is it true that if you have some other disease or a medical problem, it can compromise you and you're more susceptible to get COVID?
Yes. And if you do get COVID, you're more susceptible to have complications of, other effects like uncontrolled pneumonia and, whatever your underlying health issue. I think COVID is not going to help it. It's probably going to go through periods of, needing extra medications or extra protection to help you. So extremes of age, underlying health issues, all these will, just add to the burden on your body to fight with the immune system. So any immunocompromised host, the virus is going to love that field and and stay on longer. Yeah.
So I've always heard that it's not good for the disease to kill us off. It would prefer to have a host that keeps it alive for quite a while. Is that sound silly, or is that reasonable?
How do we know the intelligence of that virus to that extent? So the virus comes and kills. That's it. When you think of the viruses in the past, the smallpox and other diseases for which we have vaccines, because they used to kill the patients.
Yeah, the conquest of the Americas was widely attributed to be more smallpox than it was Europeans shooting people with guns.
Right, right. The virus outsmarts the human behavior, and we need to learn from nature. I think every aspect of nature is a teaching lesson for us. And then our behavior has to change accordingly with what the environment gives us and what we need to do. I mean, since I'm representing Breathe California here, what we've done with the cigarettes, all the anti-tobacco battles, we have come ahead. So we don't, spread the lung problems, the COPD, and everything else. So we learn by science, we learn by our human behavior, and try to see the best that we can for the community.
So we've got a minute and a half left. How would you summarize what you want people to learn today?
Well, take all the safety precautions whenever there is a viral infection. So right now in winter season, take your vaccines, your immunizations for influenza. And if you've not had your COVID vaccines, please go ahead and get your boosters so that you're well protected, so we can nip. And I can't say nip it in the bud. It's already flowered, but at least let's try to stop it further spread. Let's hope that 2023 is a productive year from the human angle of safety and good health.
So, Dr. Lulla, thank you very much for joining us. Next show, I hope you can explain another very important lung disease to us, COPD. So we'll be back with you next week. And thank you very much for your help with COVID today.
You're welcome.